Hello, my name is Harmony. I'm a PN student at Williston State College, and today I'm going to be showing you passive range of motion, bed positioning, and ambulating with a gait belt. I'm outside the patient's room. I have verified that she doesn't have any nausea, dizziness, or pain, or any restrictions for range of motion. So I'm going to enter her room by knocking, washing my hands, and I'm going to close the door for privacy and introduce myself. Hello, my name is Harmony. I'm a PN student, and I'm going to be doing some passive range of motion with you. So I'm going to lift the bed to a good height. And my partner is going to scan the room quick before I get range of motion going. All right, so I'm going to verify that this is Miss Jones. She is, and date of birth matches. Hi, Miss Jones. We're just going to be doing some range of motion with your neck here. So we're going to start with some flexion, then extension. Then we're going to go to the sides, do some rotation. Did you tolerate that okay? Good. So we'd repeat that 5 to 10 times. Now we are going to go to her arm. I already did the side furthest away from me, so we're going to do some shoulder range of motion to start. So we'll do flexion and extension. So flexion, extension. If you feel any resistance, stop your movement because you could injure them. Then we are going to do some abduction and adduction. So abduction, adduction, and then we'll do internal rotation of the shoulder, external rotation. So internal, external. You'll repeat all shoulder movements 5 to 10 times. Now we're going to go down to our elbow. So we'll do flexion, extension, and then pronate and supinate. So we'll flex and extend 5 to 10 times, then pronate and supinate 5 to 10 times. Now we're going to go down to her leg, and we'll do the one closest to me because I've done the one on the opposite side already. We're going to do some hip and knee range of motion, okay? So we want to make sure the knee stays at midline when we do flexion and extension, and we had a little resistance there, so I stopped. We'll repeat flexion and extension 5 to 10 times. Then we are going to do abduction and adduction, and there was no indications in her chart that she should be able to do this, so we'll abduct and then adduct, and then we'll do some external rotation and internal rotation, and repeat all of these motions 5 to 10 times. Did you tolerate all of that okay? Good. Okay, so I'm going to have my partner come and help me boost you up in bed so that we can get you into some different bed positions. And I move the pillow so that we don't hit your head on the wall or the top of this. So we're going to have my client put her arms across her chest, and then we'll roll the slide sheet up close to her body and hold by her shoulder and her knee or her hips. Then we're going to position our feet facing towards the top of the bed and shift from front to or back to front. And we're going to have you come up to my corner over here. So on the count of 3, we're going to go 1, 2, 3. Perfect. Okay, so now we'll put the pillow back behind her head. And then we are going to put you in a lateral position. So I'm going to have my partner again pull you while I push over, okay? So I'm going to have you cross your arm over. Perfect. Okay, 1, 2, 3. And then I'm going to tuck a pillow behind your back so we can keep you on your side. Good. Then we'll put a pillow between your knees here, have it bent. And then we'll put one right underneath your arm just to get you all nice and comfy. All right, so this is a right lateral position. Now we're going to put you in supine, so we'll remove the pillow from underneath your arm there, and then your back. My partner will take those pillows. Perfect, and then we'll lie you back down. Good. Okay, now we are going to put you in supine, so the bed is already flat, and we haven't changed it at all, so if it would have been elevated at all, we would have flattened it before boosting her up in bed. Now we're going to put pillows underneath each arm and then under her knees. Now we'll lift them up at the joint. Perfect. Okay. All right, so she's in supine. Now we're going to readjust her one more time into high Fowlers. So we'll remove the pillows from underneath her arms. And this bed doesn't have an elevated knee, so we are going to leave the pillow under her knees while we raise her up. into a 90-degree angle. Okay, perfect. Now we'd be putting a gait belt on, but I'm going to have my partner come in and we'll do that part with her. I'm going to bring my wheelchair over to the side of the bed, put the brakes on it, make sure that it's close, and then I'm going to have my bed low enough that she can have her feet flat against the floor. Perfect. Okay, so we're going to put the gait belt on. I'm just going to give you a little bit of a hug here. And we don't want it too tight, so let me know if it feels like it's too tight. Okay, so I should be able to fit 3 fingers under. And while she's sitting here, we're going to let her dangle for 1 to 3 minutes to make sure she doesn't have any orthostatic hypotension. We'll put some non-slip socks on. Okay, how are you feeling after that? Good. Good? Okay, so I'm going to put my toes up against her toes and then my knees against hers. And I'm going to have you put your hands up on my shoulders. On the count of 3, I'll have you stand nice and tall. 1, 2, 3. Good. Now we're going to shimmy. Once you feel the chair behind your knees, you can have a seat. Good. All right, so now she's sat for a little bit. We're going to get you up and ambulating. Does that sound okay? Yep. Good. So we're going to do the same thing. I'll have you hold my shoulders. And then on the count of 3, stand nice and tall. 1, 2, 3. Good. So we're going to have you ambulate. So I'm going to hold on to the side of you a little bit behind, and we can take a couple steps. Okay, and we can head back. Do you want to sit in the chair or on the bed? Chair. Chair? Okay. So once you feel it behind your knees, you can have a seat. Good. All right, so she's comfortable. I have the bed table next to her. The call light's within reach. She's safe. And I will document everything before I leave the room. And as I leave the room, I'm going to wash my hands.